These are tough times in the hospital business. The Oregon Association of Hospitals and Health Centers reports that Oregon's hospitals are in their worst financial condition in 20 years. They report that on average, the hospitals spent more than they made last year. It's kind of a downward slide. Median income in 2020 was 4.1%. Then in 2021, it was 3.2%. And then last year in 2022, it was minus 2.8%. By the way, it's bad when your income is a minus number. Part of that cost was paying their people. The average cost of each person went up by 26% over pre-pandemic levels, they tell us. So that's part of what's been fueling what some of you have heard from the hospitals about how they're struggling to keep up, even with the extra pandemic money that they got from the feds in the last couple of years. Now, on the other hand, hospital workers, especially nurses, have told us time and again they are overworked and burned out. A national poll by the American Nurses Foundation found that 89% of nurses say their organization had a staffing shortage, which is why it's good news that Oregon's House Bill 2697 does appear to have agreement now by both sides. It's a bill working its way through the legislature right now, which lays out how many patients a nurse can care for. In an emergency department, one nurse for one trauma patient. Other nurses in the ER could care for as many as 4 patients who are not trauma patients. In the intensive care unit, it's one nurse for every 2 patients. In labor and delivery, it's one nurse for every 2 patients if they are not in labor or experiencing complications. It goes down to one nurse for 1 patient if they are in labor or having complications. In postpartum, it's one nurse for every 3 mothers and babies. In the operating room, it's one RN for 1 patient. In post-anesthesia care, it's one nurse for 2 patients. In the oncology unit, which treats cancer patients, the ratio is 1 nurse for every 4 patients. For nurses in the pediatric unit, it's the same, 1 nurse for every 4 children. Alma McCarty joins me now. Alma, you've covered this hospital staffing bill, and I know it's HB 2697 for the past several weeks. What's the deal here?
This is the one bill that the hospital administrators, the hospitals, and the nurses union, they were getting kind of hung up on. The rest of this nurse staffing, hospital staffing package they agreed on, but this one had to do with nurse to patient ratios.
Okay, and we've heard teacher to student ratios. Is the same idea?
Same idea. I mean, the essential bits of this is there are going to be ratios in place that vary per department to make sure that people who are in the hospitals are getting the best quality care. These nurses want to provide that, and they feel like over the past several years, they haven't been able to do that.
And I think they're saying that's why nurses are leaving, right? Because of the burnout?
Absolutely. I mean, based on just the workload that they have now, but after a global pandemic, the past 3 years have been really, really tough. And even though this pays well, we pay well in Oregon for nurses, but they say it's not even worth it at this point. They are burned out and they need something in place in order for them to do their job properly.
And so I hear you saying the problem is they're running around taking taking care of too many people, so they can't spend enough time with each patient, which is really not what they got in the business to do, right? They want to help people and they're nurturing and caring.
Absolutely. And so depending on what department you're in, if you're in the emergency department, there's like a 1-to-1 ratio. It kind of ups depending on, again, what the department is. But essentially it's that. They want to be able to provide quality care. They feel like they haven't been able to do that. They're doing the best that they can, but every day they're getting home, they're overwhelmed, and they're thinking, is this for me anymore?
Yeah. And everybody loves nurses, but at the same time, it is a business. And I could see the administrators saying, well, just like with schools, if we have to have 1 nurse per every, patients, whatever the number is, that's going to limit who can come in the door and how many can come in the door and how much money we can make.
That is exactly why they were nervous in the beginning until they got to this point where they agreed on some amendments. There is now some built-in flexibility with this bill. So depending on what's going on in the hospital, these ratios may not always need to be abided by, if that makes sense.
Yeah, sure.
So yeah, there's some now built-in flexibility for hospitals so that they can admit patients and not turn anybody away, but at the same time also focus on what the nurses need and their workloads essentially.
So the nurses feel like they're getting somewhat what they need with these ratios. The hospitals feel like they're not going to go bankrupt because of it. As a patient, would we notice any difference?
I think that maybe not right away. This is something that if it becomes law, it would be phased in over time. However, you might see some, better quality care. I think it all comes down to that. Nurses and other healthcare providers being able to sit with you and really take in what your needs are instead of rushing around and trying to cater to too many people.
Yeah, has it been interesting watching sort of this develop as you're covering it?
Yes, absolutely. What struck me was really the emotion from both sides, but especially from the nurses. Like you said earlier, people don't get into this just for another job. They really feel like it's a calling, but they're hitting that point where they have literally said, we are at our breaking point. We are going to get out of this field. We are going to do something completely different because to us, we are not able to hit that level that we've set for ourselves in terms of taking care of patients in the hospital.
Yeah, and nobody wants to go home thinking, gosh, I couldn't care for that person the way I wanted to.
Yes.
That's bad on me. And then you start to think, why am I even doing this?
Absolutely.
Yeah. Well, I'm glad they found a compromise.
Absolutely, and it still hasn't become law. Of course, there's some
fingers crossed.
Fingers crossed.
Yeah.
But,
all right.
yeah.
Good stuff. Thanks, Alma, as always. Great reporting. So what are your thoughts on the nurse to patient ratios? Maybe you're a nurse or you have a loved one who works in the field. Maybe you're often going to the hospital and you've experienced long waits on a regular basis. Do you think this bill is going to help? Send us an email, will you? Let us know. The address is thestory@kgw.com or call and leave a voicemail, 503-226-5090.